My name is Dr. Kara, and in this movie I will explain you something about glioblastoma stem-like cells and their niche. Glioblastoma is a cancer of the brain and spinal cord. This is a tumor of glial cells, non-neuronal cells that are important for support and protection of the neurons. Glioblastoma is a very aggressive cancer type with less than 50% survival rate in 5 years. A growing body of studies show that the formation and maintenance of glioblastomas likely relies on so-called cancer stem-like cells. The cancer stem cell hypothesis proposes that cancers are derived from a small fraction of cancer cells that constitute a reservoir of self-sustaining cells with the exclusive ability to self-renew and maintain the tumor. Rather than regenerating tissue and repairing the brain, these cells are programmed to destroy. But before we go into the specifics of cancer stem cells and their niche, I will explain you something more about the normal situation. Normal glial stem cells are pluripotent, divide slowly, and in an asymmetrical manner. Stem cells in the brain give rise to two daughter cells. One will remain a stem cell, and the other will differentiate into a neuron, oligodendrocyte, or astrocyte. This way, brain tissue can be replenished with fresh glial cells. Stem cells are protected by a special microenvironment called a stem cell niche. The niche is in close contact with surrounding blood vessels and is lined by their endothelial cells and stromal cells. Within this niche, perfect conditions for the dividing of neurostem cells are created. The closed blood vessels supply the niche with nutrients and oxygen. Now let's see how a glioma stem-like cell divides. A glioma stem-like cell can, like normal stem cells, undergo asymmetric division. In this process, a daughter cancer stem-like cell is formed and a fast-dividing glioblastoma cancer cell. These latter cells will form the bulk of the tumor. The slow-dividing glioma stem-like cell can be identified by mass spectrometry because they express CD133. They also express the receptor CRCX4. The CRCX4 receptors on the glioma stem-like cells are attracted by SDF1-alpha, which is a homing protein. Stem-like cell uses similar tactic as the normal stem cells and create a niche to protect themselves against stressors. The niche is in very close contact with blood vessels and lined by its endothelial cells, smooth muscle cells, and stromal cells. The niche itself contains glioma stem-like cells and normal glioma cells. A cancer stem cell niche is characterized by necrotic and hypoxic environments. The hypoxic environment is necessary for maintenance of the undifferentiated state of the cancer stem cells. It also protects the cancer stem cells from oxidative stress, which can lead to DNA damage. Furthermore, the hypoxic conditions of a cancer stem cell niche can induce angiogenesis. This is the formation of new blood vessels. The newly formed vessels provide the glioblastoma with the many nutrients needed for tumor maintenance and growth. Currently, glioblastoma is treated with radiation or chemotherapy. However, the main problem with glioblastomas is that the recurrence rates are high. The reason behind this is that chemo and radiation therapy successfully remove the normal glioblastoma cells, but fail to target the glioblastoma stem-like cells. These are very resistant against treatment and can therefore initiate new tumor tissue to proliferate after therapy has been completed. In laboratory models, stem cell-like cancer cells are responsible for start of glioblastomas. Finding ways to alter the microenvironment of cancer stem cell niches, or by targeting the niche-specific factors, may be promising targets for future therapies. The ideal anti-glioblastoma drug should discriminate between glioblastoma stem cells and normal neurostem cells, destroying the former and preserving the latter. By destroying the source of the tumor, recurrence of the tumor could be prevented and the survival chance of patients could be improved. Thank you for your attention. Hopefully you now know some more about glioblastoma stem-like cells and their niche. Bye bye.